Okay, so I've been assigned to talk a little bit about anemia and what that is. So I chose to do a simple diagnosis teaching, kind of touching upon a few of the different types of anemia. So, what is anemia? Anemia is an abnormally low amount of circulating red blood cells, your hemoglobin concentration, or both. It is an indicator of an underlying disease or disorder. Diminished oxygen carrying capacity and delivery to tissue and organs can result, and our goal of treatment is to restore and maintain the adequate tissue oxygenation. There are different types of anemias, and they are both related to hemoglobin and hematocrit. So basically, hemoglobin is carried by the red blood cells and it transports your oxygen and CO2 to and from the cells. Your hematocrit is just the percentage of red blood cells in relation to the total blood volume. And the four types of anemias that are most common are aplastic anemia, iron deficiency anemia, pernicious anemia, and sickle cell disease. I have previously made a full video on sickle cell disease, so in this video I'm going to focus on the first three, which is aplastic, iron deficiency, and pernicious. So there are a few risk factors for anemia. The main ones I want to talk about are acute or chronic blood loss, inadequate dietary intake or malabsorption, and bone marrow suppression. So in iron deficient, the T is supposed to be a little more up there, but iron deficient anemia is caused by an iron deficiency. Without enough iron, red blood cells can't carry enough oxygen to the body's tissues. The symptoms of iron deficiency anemia, it can delay the development of an unborn baby. You'll see extreme fatigue, weakness, pale skin. People can present with chest pain, tachycardia, shortness of breath, headache, dizziness, lightheadedness, cold hands and feet, inflammation and soreness of the tongue, and brittle nails. It is the most common cause of anemia in small children, adolescents, and pregnant women. Low serum iron and elevated TIBC indicates iron deficiency anemia. Iron supplements are ferrous sulfate, ferrous fumarate, and ferrous gluconate. Treatment with iron supplements, procedures, and surgery and dietary changes are the treatment. Vitamin C may increase the absorption of iron supplements, so drink it with orange juice if possible. Aplastic anemia, once again the last letter kind of dropped down there. It results from bone marrow suppression. It's mainly caused by exposure to radiation or chemicals, and the symptoms of that include most of the other symptoms, but can also include blood in the stool, sinus tenderness, enlarged liver or spleen, and oral thrush. We look for this by doing a bone marrow aspiration or biopsy. And aplastic anemia, it results in a decreased number of red blood cells and a decreased number of platelets and white blood cells. So I put a little picture down there so you can kind of get the idea. It's like a normal cell is like fully loaded with all these blood cells, and then the aplastic cell is just they're all kind of floating around looking for something. Pernicious anemia is a vitamin B12 deficiency. This can be caused by a deficiency of your intrinsic factor, which is produced by gastric mucosa, and it's necessary for the body to absorb vitamin B12 successfully. The Schilling test is a test that we use to measure the vitamin B12 absorption, and it's used to differentiate between malabsorption or pernicious anemia. Pernicious anemia is usually easy to treat and involves vitamin B12 shots or pills. Symptoms: the main one is a smooth, sore, bright red tongue. The others are nausea, vomiting, confusion, depression, constipation, loss of appetite, and heartburn. And finally, we get to some treatments here. So, Epigen is a hematopoietic growth factor, which is used to increase the production of red blood cells. So they give this to people who aren't producing enough red blood cells of their own. This helps them to produce more. But when you're giving it to them, you want to monitor for some things. The 3 things that are highlighted were monitoring for an increase in blood pressure, monitoring the H&H twice a week, and monitoring for cardiovascular events if the hemoglobin does increase too rapidly. For pernicious anemia, you can give vitamin B12 supplementation. Vitamin B12 is necessary to convert your folic acid from its inactive form to its active form, and all cells rely on that folic acid for DNA production. When you're giving this drug, you also want to monitor. Oh, don't pay any attention to what this says. But you're going to want to provide organ meats because that is going to give vitamin B12 through dietary intake, and you want to monitor their labs and make sure that they know how to take the med. Alright, last but not least, the procedure most used in anemic situations is blood transfusions. I'm trying to read off of my sheet here and talk at the same time, so excuse me if I pause, but blood transfusions can lead to an immediate improvement of blood cell counts and your manifestations of anemia. Transfusions are typically only used when the client has significant manifestations because of the risk of blood-borne infections. So thank you, and I hope you learned something from this brief summary about anemia.